It's just really frustrating hearing all the misinformation about Tylenol coming from the RFK crowd, especially at a time where, even post-operative, Tylenol is being used as a replacement for painkillers. And guess what? It doesn't work because Tylenol is not a painkiller, and that's why it's so nice to see articles like this one that appeared recently in Science-Based Medicine from Mark Crislip. And the basic issue is that Tylenol is not a painkiller. It's a COX inhibitor. It can help get your fever down. It might have marginal effects on a migraine, but as far as a painkiller, it isn't. But if they give you Tylenol at the hospital and you're still in pain, you're caught in a catch-22. If you grit your teeth and endure the pain, but tell them you're in pain, they'll say, well, you're not really in pain, you're a drug seeker. But if you act like you're in pain, because you are, then you're acting and you're dramatic and you're a drug seeker. And that's the kind of thing that we chronic pain patients have to navigate all the time. We need to impress upon the doctors how much pain we're in without appearing like a drug seeker, and how do you do that? And it's like in every other way, doctors take the patient's word for their symptoms, except for pain. That's the situation we've gotten to, and it's ridiculous, especially when they try and substitute Tylenol for it. So I really appreciate this article, even if he does start off being very snarky. I love his first paragraph, actually, about living in war-ravaged Portland, Oregon. But he goes on to say, I was never much of a fan of acetaminophen. By the way, for those of you across the pond, that's paracetamol, same stuff, either personally or professionally. And he's one of those doctors that believes that, with a few exceptions, treating fever is either waste of time or counterproductive, because it's one of the methods your body uses to kill whatever's invading you, the virus or bacteria or whatever. If you get the fever down, your immune system isn't going to be as effective. And so if anything, you're just delaying your recovery. Now, of course, there's such a thing as a fever that's too high and you want to bring it down, but for the most part, if you can suffer through the fever, you'll be better off. Because with a fever, your thought should not be, oh, I should bring my fever down. It's, oh, I should get rest and liquids. He says, my early clinical experience with acetaminophen was as a resident with Tylenol overdoses. I took care of 1 or 2 a year, and since it was slow, it was a particularly awful way to die. The pattern was consistent. Someone would swallow a bottle of acetaminophen as a gesture. Nothing would happen, and a day or so later would show up in the ER, chagrined and embarrassed, but wanting to make sure they were okay. They were not. Acetaminophen had killed their liver, and they would go on to die of liver failure, usually over the course of a week, and regretting it to the end. Did not make me a Tylenol fan. We don't hear much about that, do we? We always hear about the fentanyl overdoses. We don't hear about the Tylenol overdoses. Personally, I never found acetamin did anything for pain, especially compared to NSAIDs. It did not even have a placebo effect that I could tell, a great big nothing burger. It is a drug that is so ubiquitous that I cannot ever remember either being taught about it in medical school or elsewhere. Acetaminophen is. It requires no further explanation. Then came my total knee replacement, a most unpleasant experience. Not really painful. I needed no narcotics after 48 hours. He was fortunate. He was also fortunate that they gave him narcotics. But after that, it was just uncomfortable and limiting. But I was told to take Tylenol around the clock. So I did, despite my opinion that acetaminophen is worthless. I try and do what I am told. Since my medical knowledge outside of ID is sketchy at best, the doctor who treats themselves has a fool for a patient and an idiot for a physician. But I wondered, how efficacious is acetaminophen for pain? What kinds of side effects outside of killing the liver and kidney could I expect? I was curious how acetaminophen was found to be a painkiller, pain wounder, pain annoyer. It appears that acetonilide is an old analgesic. Investigations into its metabolism in the 1940s revealed that acetonilide is metabolized to acetaminophen, the sort of, kind of, perhaps, maybe active molecule. I guess they assumed that, since acetonilide was an analgesic, so was acetaminophen. But when I look for anything that resembles proof of analgesia, for acetonilide, I cannot find much. There's a series of cases from 1889 that concluded its analgesic power is not a very powerful one, but it has the enormous advantages of being free from the disturbance and inconveniences that are associated with the action of nearly all other pain-subduing agents, and for the dangers inseparable from the use of the more powerful of these agents. Yeah, they're talking about opiates. So it wasn't so much that it was a painkiller. It's that you didn't have the evil addiction problem from those evil opioids. But as he says, it was assumed for a long time that acetaminophen was an analgesic based on little to no clinical data. And he also says, if you wander the PubMeds, the conclusion you will come to is that acetaminophen is the worst of all the analgesics, depending on the pain treated, barely better than or equal to placebo. Paracetamol between 500 and 1,000 milligrams is in the least effective quartile of drugs for treating acute post-operative pain, so stop doing that! Paracetamol 1,000 milligrams has modest efficacy in migraine and tension-type headache. Paracetamol at doses up to 4,000 milligrams daily is ineffective for back pain. 4,000 milligrams doesn't work for back pain. And paracetamol at doses up to 4,000 milligrams daily is practically ineffective in arthritis. Oh, you got arthritis? Just take some Tylenol. It's not going to work. It's not going to do anything. Though marginally better than placebo, paracetamol has little chance of achieving clinically meaningful benefit in osteoarthritis. And there is no review evidence that paracetamol works for menstrual pain, neck pain, rheumatoid arthritis, or cancer pain. So migraine is the best use, fever reducer if you have to get the fever down, but you probably shouldn't. What about IV acetaminophen, which should act faster, but the results indicate that 1,000 milligrams intravenous acetaminophen is not superior to placebo in treating severe acute migraine attacks. So he goes on to about his knee pain. Pain, at least from my experience, is not experienced as a single entity. I will verify. Acute or chronic, all the pain I have had hurts in different ways. With the knee replacement, I have had at least 4 different and qualitatively distinct pains, but the team was adamant that I take Tylenol around the clock, and I try to do what I am told. So the data? All over the map, but unimpressive. One meta-analysis results indicated that compared with a control group, intravenous acetaminophen was associated with reductions in total morphine consumption and visual analog scale score at post-operative day 3. However, there was no significant difference in morphine consumption at POD1 or in VAS at POD1 or POD2. Moreover, there was no significant difference in the length of hospital stay. Not the kind of pain relief I would have found impressive, although I would note that the length of stay in these studies was 3 days. So also not applicable to my knee replacement, as I spent the night and was discharged by noon the next day, less than 24 hours from the end of my surgery, and I needed no OxyContin for pain after 36 hours, so also not applicable at least to me. But that's the point, everyone's got a different situation. But at least they did give him the OxyContin. A lot of people aren't getting that these days. I wonder if there's a chance that if you're a doctor, there's a better chance you're going to get it. Because doctors are more likely to know what the score is, and probably make for better malpractice suits. The rest of us, we get screwed. Additional intravenous acetaminophen to multimodal analgesia could significantly reduce pain and opioid consumption after total joint arthroplasty with fewer adverse effects. But a more recent double-blind study found acetaminophen to preoperative preemptive multimodal analgesia did not decrease postoperative morphine use or ameliorate pain relief, which is consistent with the overall literature on acetaminophen and pain. It does little to nothing. It doesn't work. It's not a pain reliever. 48 hours post-op, I was only taking the Tylenol, and I noticed that I felt like crap an hour after the dose. Headache, slight nausea, sweating, and a general malaise that faded until the next scheduled dose. It turns out these symptoms are common with acetaminophen, so I stopped it. The symptoms resolved, and there was zero change in the various pains in my knee. The acetaminophen was doing squat. Note that my experience is consistent with the literature. Acetaminophen is next to worthless as a pain reliever. It is no better than acupuncture for pain relief. And for the record, acupuncture doesn't work either. I got videos on that. Its role in pain control would be like that of acupuncture. When there is nothing to offer that is effective, at least you pretend to do something to treat the pain. Which brings us to pregnancy. So the good news is, based on the medical literature, I can defend this drug as safe for your fetus. In your face, RFK Jr. There's no evidence that it's bad for pregnant women or the fetus. But for you, it offers little to no efficacy and a fair number of toxicities. Now, I will say, as far as pain relief is concerned, he's right. But in a fever situation, it's a little different because a high fever can harm the fetus. So in those situations, if you can get the fever down using Tylenol, then do it. As for the pain, he writes, I might as well suggest acupuncture. Same operative characteristics for pain, and I can find no reports of acupuncture harming the fetus. Why would it, outside of an amazingly poorly placed needle? I like how funny this guy is. I think the literature is clear that, with a few exceptions, treating a fever at best does nothing to alter the course of infection and, at worst, leads to more prolonged disease and complications. Fever relief only makes the patient more comfortable. I have been saying don't treat fevers for decades and made zero impact whatsoever on the treatment of fevers. Hell, when my kids were febrile, my wife gave them Tylenol, completely ignoring me. I would wager using Tylenol for pain is too ingrained in society to be amenable to change. Unless you want to use fear based on fictions to alter behavior, and I am not a fan of lies as a motivation technique. But as he quotes Jonathan Swift, falsehood flies and the truth comes limping after it. So acetaminophen will continue to be the most commonly used ineffective drug for pain. Which is a shame, but I get people saying, oh, I'm going to take it, buy it at the store and take it. But if you're in a hospital, if you're a doctor or a nurse and you're making these decisions and you've got a patient in pain and you give them Tylenol instead of opioids, you are evil. And that's all there is to it. You are not doing your job. You are violating your oath. You are committing malpractice, and you deserve to have your license stripped away and be locked up somewhere. Because you are deliberately torturing patients by denying them the only actual painkiller we have. Tylenol is not a painkiller. It's a COX inhibitor. NSAIDs aren't painkillers. They're anti-inflammatories. All of those other things, gabapentin, all of the other things they give, not painkillers. You want to manage someone's pain and get it down? You've only got one option, and that option is not bad. There is only a minuscule chance that it will lead to addiction, and it won't even be the cause. No one becomes addicted through exposure. No one's going to suddenly overdose just because you gave them a pill, or you put it in an IV bag. That's not how addiction works. Almost all of them, something like 99.4% of them, will never become addicted. So just stop it. Please. For the love of all that is good in this world, just stop it. And let people have their pain medicine. Thank you so very much for watching. Comments for the Comic God, shares for the Share Throne. Please hit like, subscribe, and the bell. And of course, donate.bogosity.tv to keep me doing what I do. Whether it's one-time donations or regular support with Patreon, Subscribestar, or Discord, thank you so very much for watching. Until next time, stay strong and be free.